Dementia Research Dialogues. My name is Katrin Zea. I'm the technical lead for dementia at the World Health Organization, and we run these monthly dialogues to support the implementation of WHO's Dementia Research Blueprint. The idea is really to bring like-minded people, researchers, other stakeholders from around the world together to showcase how individual projects are working towards implementation of the research blueprint, how your team's work or your individual projects contribute to, us globally, collectively achieving the milestones and outlined in the research blueprint. We're particularly thrilled for today's session to have Bernardino Murillo and his team from the EU Joint Action on Dementia joining our session today, and really speaking about what the EU Joint Action on Dementia is and how it translates to the blueprint, its cross-cutting principles, its thematic areas, and we hope for very vibrant and interactive discussion afterwards. I think we also have a lot of new members or first-timers joining the dialogue, so warm welcome to you as well. I'll give the floor to Bernardino and his team in a second for an overall presentation and an introduction to EU Joint Action. But then we hope for your active contribution afterwards. We want to hear from you. You can raise any questions or start networking. With that, I'll give the floor back to Laura, who will overall be the facilitator of the meeting, and then back to or over to Bernardino. Thanks, Laura.
Thank you so much, Katrin. And again, thank you everyone for joining us. So Bernardino, I don't know if you will be sharing your slides or someone else will be, but you can go ahead and start your presentation. Perfect.
Can you hear me?
Yes, we can hear you.
Wonderful, wonderful. First of all, thank you, Katrin and Laura, to invite our team here to present to all your audience or your team blueprint from World Health Organization, all the team and all the effort you are doing to merge all the community around dementia. It's amazing. We are learning a lot. We're still knowing people and meeting all the community around dementia because, as we explained in a while, we are experts from different governments from Europe, and right now we are trying to be involved in all the activity related with all the fields you are covering. We are one part of those that it's related with the EU activity and how the governments and the public organization are working with. First of all, I want to present our team. We are representing 17 countries here. Luckily, we are in 30th of July, so it was very difficult. I want to congratulate all my work package leaders here. We have representing all the work packages here. We are a total amount of 10 work packages in the JADE Health. And thank you for the effort. I know some of you are on holidays and you are stopping your relax to be here. Thank you for your effort, and thank you all the audience to be involved in the debate we will start today. We will expect to have a very successful conversation today. We will spend around 15 minutes presenting what we are doing, and we expect to have the time after to talk about any of the questions you will have. First of all, as I said, we are EU for Health activity. EU for Health means this is a joint action. Joint action is working together to achieve one objective, one main need explained and call produced by EU community, the European Union. And normally the countries applies to this kind of call, and normally you prepare a consortium together, working around a year before to work with the topics provided by the European Union in different work packages, different goals, and different methodology. We are starting 6 months ago. We started at the beginning of January in 2025 the works, and it's important to say this is a joint action of 3 years. That it means that is a small joint action. Here you are the figures. We are, as I said, 17 countries, 46 participants. We try to have all the countries included in the consortium, but sadly, not all the countries, all the governments are actively working in some of the fields we are working with. And of course, here we are really interested to have people from the countries not participating mainly, but of course, the countries that now we have representation, you have some connection in your country with this joint action. The joint action, as I said, started at the beginning of January, ending in 3 years. And we expect to have a total amount of 44 pilot action. That is something related with a clinical action, a clinical trial, and around 7,500 people will be taken into account during all the process. We are talking about patients, professionals, caregivers, many profile of people that we are including there. Mainly, the most important information we will provide you here is JADE Health is really wide. Really, the objectives are really open to work with all of the fields that dementia, other neurological diseases are related. First of all, we have the goal to work with the best practices implemented in health system in Europe. We are looking for best practices and how to implement as soon as possible, as easier as possible in the different countries we are working with. And of course, we are working in new collaboration, new treatments, the access of care and policies. Of course, we are here. Governments develop policies, and policies provide new solutions in the real world. In the end, it's the work we are doing here. And we are not researchers. We are researching, but the aim is not develop a new research. We are trying to implement as soon as possible in the different centers we are working. First of all, we had different target objectives. Right now, mainly we have stigma, we have prevention, we have a special attention to vulnerable groups, and attention focusing on person-centered care models that are new kind of techniques, new kind of activities that we are very focused on and working day by day. Of course, we are really interested to improve the activation and the proficiency of promotion and prevention in the field of dementia and other neurological diseases. And of course, last but not least, we expect to improve the awareness and health literacy in the community, okay, in the countries and other places. Of course, those are very big objectives, difficult to land properly in the field, but we worked to have different work packages. Those work packages are really common among all the all the EU joint actions. Normally, you have the same structure, and the structure normally provides different solutions according to the idea of the project behind. Right now, here you have the structure. We have six technical work packages: health literacy, early detection, prevention, care pathways, person-centered care models, and the last one is the work package working with stigma awareness. Those six main topics are helped by different transversal work packages that are management and coordination. We have communication and dissemination. We have evaluation, methodology, improvement, and sustainability. Mainly here for researchers and people interested, you will be get in touch with the different six technical work packages that are the teams behind the real world activities, and those are helped internally by the other four transversals. So you will see in vertical the six main work packages, and easier to read and easier to connect. You have here 1, 2, 3, 4 are the four transversal, the four supporter work packages, and 5, 6, 7, 8, 9, and 10 are the technical work packages. All those topics have been selected carefully, reviewed by European Union according to their calls and their advances, and they are, different boxes. They are separated teams working in parallel. Of course, you have different communications between some of them, but normally they are working in different pilots, different budget, different activities. They are working, as I said, as a group, research groups in different ways. So you could be in touch depending of your interest. You could access to the different institutions leadering. Normally in this kind of joint action, you have a leader and co-leader because it's really complex activity. Normally you would need help during the process. You could have an entity working with, for example, prevention, very expert in general public prevention, but it's not working or not without expertise in the prevention in some groups, minorities, in different ways. So normally we develop leader and co-leader group, and of course, behind leader and co-leader, you have other entities behind. So important to say, if you need any contact, any help about that, you have the link, of course, in the webpage, but here you have the list of the entities behind. If you are working in some of the countries included in the list, don't hesitate to get in contact with the entities in your country. I think it's the best way to be involved in the different activities we will be explaining in a while. Of course, if you are you are expert working in one field, not including the leader in your country, you could get in touch with the country you are interested, because, for example, you are thinking to work in early detection and you will be in contact with Bulgaria. Of course, BSD, they will help you a lot in the need you have, or if you are interested to be involved in your country in any pilot, anything like that. After that, important to say, we have, as I said, different entities, not only leaders and co-leaders, we have entities behind. And you have here in the chart the entities included in the different technical work packages, also the number of pilots expected by each of them. Each of the entities are leading different pilot activities, the participants, expected participants by work package, and the target audience, as I said before, patients, families, professional caregivers, population in general, different profile of the society involved in the activities we are thinking or we are preparing. the area where we are working with, and this is very technical, the task or the number of the of the technical document we have been reading, the specific task involved in the pilot. So this is the main summary of what we are doing and who are the entities behind. Of course, the portfolio, the previous activity take into account is really important, and here we are to know better what dementia community are working with. But initially, we started working with three main lines, three main best practices that we take into account. It's important to say in European Union, we are taking very seriously the best practice portal. EU best practice portal is really interesting to know, because you have the experiences developed previously in European Union projects, joint actions, or other Horizon Europe, etc. Activities. They are organized, ranked, and clearly explained. And normally, it's really standard. You select some best practices to be taken into account during the beginning. Joint Action, JADE Health selected 3 of them. You have here 3 lines where we are working. I think you will be really interested to know about them. First of them, it's memory and cognition consultation program. This is a really interesting program explained in a while. Care planning and integrated care organization, and smart aging mind brain. 3 of the programs working with dementia, health care, care planning, and of course mind care also. You could read more than here in the document we are developing right now, how we are including those activities in our main production. This is the first one, the memory and cognition consultation program. You have here how we are including the early detection, in how we are connecting the quality of life with the caregivers and the personalized activity, how to integrate the knowledge and the decision making during the process. Of course, the interdisciplinarity that is very, very important in the type of project we are developing. Pilots are well connected with activity before, because some of them, as I said, are related with prevention or early detection, etc. But normally they have some work with awareness of health literacy. They have some interconnection that this best practice is really, really helpful. Secondly, we have the smart aging mind brain. This one is more related with ICT. Many of the pilots we are developing, around half, are working with technology. How the technology is integrated in the pilot is really difficult, because normally we need some help, or we need some guidance about the new future. I have to remind all of you, we are governments working in the offices. We are not technology developers. We are not. We are working in hospitals, or we are working in the centers, but we are not working in companies, in private entities. So this is something that we must to take into account, that is really important to be guided. So if you are part of this kind of entities, we are really interested to know more about those technologies, because we are still working day by day, especially Work Package 9, that the leader is here, or Work Package 8, Work Package 10. Some of the work packages here are working with technology. And this best practice, smart aging mind brain, is working with that very, very smartly. Third, last but not least, we have the care planning. JADE Health is working, half of the technical work packages is working with social care of dementia. This is really tricky because maybe you could consider it's not clinical and it's not working with the symptoms or working with the illness itself, but at the same time, it's really important for governments, and this is the most important part in many of the awareness criteria or everything related with the patient model care, etc., reducing the stigma, working with discrimination, working with fears, with the wishes and how people living. It's really important. This is the half of the work we are doing. For example, work package 8, 9, and 10 are working with them in the different lines. And care planning and integrated care organization is really interesting best practice we are using during the process. In summary, very briefly, we have those 3 best practices during the process. Every day we are using different sources of information that is important for us. Currently working a lot with World Health Organization. You have plenty of solutions and previous work and guidelines and information very helpful during the process that we are using daily. We are working a lot with the information and sources developed by the Alzheimer's Europe and other NGOs in the dementia field. And of course, we are working a lot with different activists and different information provided by caregivers and professionals that are sharing the information and organizations that have publications during the process. All of this information, the first step where we are working, are key for us. And now we are starting to produce thanks to the work done before. Last but not least, and this is the most important aim for me, it's to engage you in our work. We have a channel to work with people interested to be involved in JADE Health. Our web page is JADE Dementia EU. That is the main web page where you could be informed about advances, informed about the document we are producing, the pilot's results, and how to be involved inside. You have here the QR code, and we are looking for stakeholders. The first list of people involved in the project is a stakeholder list. Those stakeholders we will take into account to develop communication and dissemination, to be involved during the pilots if you are interested, to be part of our training professionals, be part of experts in the different field we are working with in the different pilots. We have several tasks where we need someone to work in the different lines. We have, as I said, different opportunities to develop your work. If you have, you are inside an entity, public or private, interested to work, please don't hesitate to be in contact. Right now, we have those entities as stakeholders, maybe more because this image is maybe 1 month ago, but it's true that we are really interested to spread all the activity as much as possible to have the best professionals involved in the pilot we will start next year. So right now, this is the activity, this is the current situation we have. And as I said before, we are really interested to know if our work packages, if you have any question about any of the work packages, we have here work packages leaders to answer you any question related with, and if you have any question related how to be involved and what is expected by the different entities and people here, we are here to provide you any information. Finally, I want to share with you the activity, the scientific activity we are doing this year. We will be in Bologna conference in October, in dementia main event in October. And if you are attending there, we will be around 4 or 5 people from the different work packages attending. We have an oral presentation, and we will present all the advances during this year, the first year we are doing, and we have 3 posters explaining work package 6 and 7 mainly related with the prevention and early detection activity. And of course, if you want to talk with us in person, we will be very, very glad to have a while with you to talk about the activities, or to be trying to work together. Thank you. In the name of all the participants, the floor is yours, I think, Laura. And if any of the work package leaders here want to add anything or to provide any clarification, of course, you are really welcome to do anything if you need. Thank you, Laura. Thank you very much.
Thank you so much, Bernardino. It was really great hearing about the work that you and your colleagues are doing. As you mentioned, I don't know if anyone from the team would like to add anything else. If not, I can just kind of go ahead and facilitate the rest of the conversation. Okay, if at any point you do want to add something, just raise your hand. I will make sure you have the floor. I see that Catherine added something on the chat, so I don't know if you want to comment on anything, Catherine, and then we can start with questions.
No. Thanks, Laura. No, so I just put the for our newcomers in the session today, I've provided the links to the blueprint, to the EU Joint Action main website, and then also put a screenshot of one of our summary slides of the blueprint. It's 6 thematic areas that really kind of cross or start from epidemiology and cost and burden of dementia to drug discovery, clinical trials, but then also diagnosis, treatment and care, all the way to risk reduction. And you would have recognized in Bernardino's presentation that some of the work packages of the EU Joint Action actually align really closely with the thematic areas of the blueprint. And then what you see on that slide also is the 8 cross-cutting principles, which are really the drivers of research, or the things that we need across all the areas to really provide or change the infrastructure so that we can conduct research sustainably, equitably, in all parts of the world. We can, if you have specific questions for blueprint, we can also address them. But I just thought it might be good to have them here for reference. And with that, I hand back to Laura. Thank you.
Thank you so much, Catherine. And Bernardino, I see that you have your hand up. So if there's something you want to add.
Sorry, I mean, no question. I am having problem to access to the chat. The chat is only available to the members of the team, I think. I don't know if other participants are accessing to the chat, but in my case, I am not accessing. Sorry.
Yeah, we still haven't figured out why not everyone has access to the chat. That's something that I think happened. But I know not everyone has access to it. And I think there's something in the back end and we haven't figured out how to change it. So apologies for that. Blossom, go ahead. I see that you have your hand up.
Lovely, thank you so much. Bernardino, that was really wonderful presentation, so thank you so much. So I'm actually based in Australia, and the project is really interesting because a lot of the work packages and programs that you're doing in Europe are really overlapping with what we're doing, particularly around the health literacy and data access and dementia prevention. And I'm wondering whether or not you and the team are interested in that international collaboration, and how, if so, as an international partner, how we could potentially link with this EU program of work. Thank you.
Yeah, thank you, Blossom. Of course, we are really open. We explained that activity, that joint action in the environment of Europe, because in the end we are working in that area. But of course, we are really interested to work with all the activity. We didn't mention because it's really difficult to mention everything, but we are integrating some plans and strategies from North America, and some of them for UK, but technically it's not included in the European Union activity. But of course, if we could open the gates to include Australia activity and to compare, to try to learn better how you are doing it, we are really interested to do so. Our email is in the link provided by Catherine and Laura, and we will get in touch during the next week to try to work together and to integrate your activity in ours. So thank you very much. Thank you.
Oh, that's wonderful. I will email you. Thank you.
Thank you so much, Blossom. Is there anyone else that has a comment or a question that you would like to ask Bernardino and his team? I'll go ahead and ask something while you think about that. But I was reflecting on the drivers of dementia research, which, as Katrin mentioned, we have a picture in the chat, and particularly about the engagement of people with lived experience in these projects. And I'm wondering if you can share a little bit of how this is happening and the type of engagement that is taking place for this.
Well, I think it's a really good question, because many of the participants maybe are included in a research group or in a research institution that maybe could have many of the I don't know if the question is for me, sorry, Laura, or
either for you or for anyone from your team that would like to.
Okay.
Maybe people working in the specific packages may have a better answer. I'm not too sure,
Okay.
but just in general, how people with lived experience are being
Okay.
engaged, not so much as participants, but really to support the implementation of this work or the planning of it. So more at that stage,
Wonderful.
not so much as participants.
Wonderful. I only want
Yeah,
to.
sorry, I was just to jump in, Bernardino. I was, because the chat's not working. I wanted that everyone had at least a chance to see what I was talking about. And Laura in particular was talking now about the 8 drivers of research, and here the one on empowerment and engagement. I'll stop sharing again now so that everyone had a fair chance to be literally on the same page. Back to you, Bernardino.
I have a comment if it's okay, Bernardino. Sonja here from Aarhus Municipality, Denmark. We are VP lead of VP9, but actually the EU for Health program, our joint action, is not working on research. We are more working on sharing experience and learning from each other. So we are not research institutions. We are not in Aarhus Municipality, but of course there are research institutions on board in this partnership, but we are not directly researching. Bernardino, could you also comment?
Explain brainlessly. In any case, I wanted only to highlight, of course, the Sonja Hansen explanation that I think we explained before in the previous in the preparation of the meeting. I think it's really important to explain, but that means that we need researchers. You know, the most important part here, we are between the research development and the patients and the real health activity, because we are developing regulations and trying to integrate the new activity in the field as soon as possible. As Sonja said, the most important part here is we are working in the European calls model, and I think many of the researchers here could be interested how to be involved here. I think you have 2 options or 2 ways. The first way is to present or to apply to an individual call with your research idea or your activity right now. This, I think, under our opinion, it's really difficult because the language and the preparation of the call is really difficult, and in the end you need some expertise behind. So I highly recommend any of the participants here to be guided by any of the entities working in that kind of calls before. And secondly, second option is to be involved in any of the joint action similar than the joint action we present today, to be part of a pilot. I think it's a very good idea because you are guided, you are having an environment where you could develop your activity, and you will be included in a line that is, as you said, very wide and working with the different topics that we have in dementia now, trying to solve. And in my opinion, is the two main ways, or the two similar, the two most important activity to develop as a researcher. As Sonja said, we are trying to integrate that in the society as soon as possible. So this is our work in the end. Yeah.
Yes, thank you, Bernardino. And just a short, only that in our work package, we are looking into different technologies, digital solutions, or models, how we can pilot, test them in the different partner countries that are involved in our work package. And this is not research, but still it's whether current working solutions or new to test if this is a good idea to implement in the different countries to help the area in dementia care.
Thank you for clarifying that. I appreciate it. Catherine, go ahead.
Yeah, I think that the key here was implement, right? So the focus that we're seeing that that you're bringing, or the part to this research dialogue that you're bringing to the table is really coming from government perspective, being the program implementers on the ground and being tasked more or less by the EU with this joint action to go through the different work packages, which are aligned with research goals and aims that we have. Also, really scientific agencies and institutes around the world working on, by really trying to bring all these different groups together, and therefore allowing that ongoing exchange and mutual learning. So from hearing from you what it is that you need, and hearing from researchers on what they're currently doing and what they're currently inventing new.
Thank you, Catherine. Elizabeth, you can go ahead.
Yes, thank you, Laura. Going back and regarding how to engage people living with dementia, regarding this, we are considering doing so through patient associations in order to obtain first-hand information. For example, in Work Package 10, we have to design a rising awareness plan, and we are thinking about how to gather input from patients to determine who we should target and who message we should convey or send to the target audience. We are in the first step to do that, but we consider that also is important to take into account the voices of patients and their families, also the professionals who work with patients, but it's important to take this into account.
Thank you so much for that, Elizabeth. And just a little plug-in, because next session, so that would be in August, we'll actually have a conversation about the engagement of people with lived experience. So that might be a good session for also your team to attend, because then you might be able to get ideas on how to do that and connect with groups that are doing that already on the ground.
Yeah, of course. Thank you.
Thank you. Bernardina, go ahead.
Yeah, I'm trying to add to Catherine's explanation, Brian explanation about what we are doing exactly. It's important to say that when you think about research and clinic activity, you must know governments and activity in hospitals normally have resistance to change, and I think and this we are seeing all days the joint action and activity we are explaining today here. It's wonderful to uh, break that resistance of change. Normally, it's difficult to apply some technologies because are unknown or difficult to implement individually and in a test or in a pilot. And those kind of joint actions are really strong because they are massive. They are working with several countries. They are working with several experts behind. We have several people from different countries providing solutions, how you implement in your country. So we will try to do in that way. This is the best case scenario to try to do something new. As we know, everything related with health is changing every day, and implementation of new solutions are really difficult. So joint actions right now are demonstrating it's a very good environment to implement different new things, new technologies, as Sonia said, or new method of care, or new campaigns how to aware patients or population. So you must to think about that. The resistance of change is the main difficulties of the main work we are doing every day, and not only balancing the difficulties of implement technically, always take into account the society where we are working, the legislation, and how to implement as soon as possible in that way. So I wanted to clarify because I think it's really important to explain where we are, okay, and what is the help we could provide to any researcher here.
Thank you so much for that clarification, Bernardino. Is there anyone else in the audience that has a question that they would like to ask? I just have one follow-up question regarding timeline, because I think it'd be really interesting to have this group again present in the future, because it sounds like right now you're still kind of in the early stages and trying to understand the landscape and how to start implementing some of the work packages and pilot projects that you have. So when do you anticipate having some of this work actually rolling out and potentially kind of being able to come back to the group to share what has happened on the ground in terms of that implementation work?
Well, as we said, in Bologna in October we will have the first results, so the first guides. First year 2025 in December we will have several plans related, for example, with awareness or related with the different pilot preparation, etc. So we are after the second half of the year, we will have several results now in development, as Elizabeth said. But I think the first results interesting for the audience will be the detail about the 44 pilots we are preparing. Those pilots are located in a specific place with a specific activity and demonstrating something individually. They are organized by group, by different work packages, but working in parallel in the different technologies. So I think this trial protocol, because in the end they are trials, are really interesting for the different researchers according to the lines they are following. Secondly, after those trials, second year, we will have the results of the trials, results about the succeed or not of the implementation of the technology or the care pathway or the awareness campaign, etc., about the results itself. And I think the second year is really interesting for the audience in that way. And the third one, the third part, the third stage of the project will be the result itself, the summary of the entire activity, the communication of those in scientific publication papers, etc., and of course all the national and international activity of communication and improvement of society activity we're working with. For example, Elizabeth said about the work with families and associations that are key, and training activities we are in parallel. For example, communication work package is really active in terms of communication and dissemination, working with local events that are really interesting. If you could attend local events or cultural events related with dementia, I think it's really, really interesting. They are very good planned, under my opinion. I don't know if we have here Work Package 2 leader, but I think they are really interesting. We will be very glad to be there in some of them. And last but not least, scientific publications, scientific results are in the end the main result we expect, because in parallel the results, the indicators we are expecting are mainly the sharing of the information we are developing. Of course, the improvement in the society is the best result we expect. We have indicators related with the people involved, as I said before, but of course, about the satisfaction of the participant, about the results individually. Maybe for this audience is not really interesting, but in the end, all those results are really interesting in the future. Yeah.
Thank you so much, Bernardino. We'll for sure stay in touch to make sure, we keep that communication going so everyone is aware of what's happening. Tuan, it's so nice to see you. Please go ahead with your comment or question.
Thank you, Laura. Thanks, Bernadette, for the presentations and for sharing the project. I would like to ask you about the participating countries in your project and how your work package, articulate with the National Dementia Action Plan. Because when I look at your work package, it seems like you focus on all the actions areas, the priorities of a National Action Plan, and how it's linked to the individual national action plans in your work package. That's the first thing. And the second thing is I'm very interested in what is the definitions of the vulnerable group in your work package 10. Because like in Austria, we do have a vulnerable group, but I don't know what the definitions in the European countries. Thank you.
Very good questions, both of them. First of all, as you mentioned, national plans and national strategies have been taken into account in the different work packages. For example, I could say work package 7 is really advancing really fast, integrating all the efforts of the different countries in the prevention activity. For example, we could say we have several advances in that line, and we will share in Bologna all the effort done in the merging all the different national activity in Europe according to prevention lines, because you must separate the strategies and plans according to the topics we are working with, because it's not all the strategies or plans, national activities are important for us. Also, we are talking about regional plans, that several countries are separated by region. Italy, Spain, France, for example, have different regulation according to the regions. And also it's very important to separate according to the topics, because some of them are really strong in terms of care, for example, or other are weak in terms of technology, for example. So we are trying to balance all the regulation and plans, strategies you mentioned, according to the need of the research. After that, we could learn from each other. The entity who is weak in some part could know what is happening in other country in that line. So for us, it's really important, and this is the main work we are doing in the first 6 months. And nowadays, as I said, we are trying to work to merge everything, and you will have publicly. You will have the results of this comparison and this integration of information. Also, we are involving guidelines and strategies from other entities, for example, World Health Organization or North American strategies, or other entities that we consider is interesting. For example, in the case of Australia, we are really interested to know better what's happening there. But it's difficult from our country, from our side, to be in contact with many of the entities. So these kind of talks are important in that line. So this is the first question. So you will have all the information in our webpage in the different work packages. Normally, it's the first task of the different work packages, this part. Secondly, really interesting, what is considered vulnerable groups. Okay. Nowadays, Europe provide us two very important vulnerable groups. First of all, immigrants, not only external immigrants in Europe, also, highlighting Ukraine immigrants. We have some, nowadays we have some groups of immigrants that have vulnerabilities related with the situation, national situation. And of course, we have minorities, mainly minorities, for example, Roma minorities, or some people with vulnerabilities in terms of illnesses. Those are integrated in the different work packages, in the different selection of patients, or strategies according to the different kind of population. But especially, work package 10 is working with vulnerabilities and awareness about stigma. So if you want to know exactly or improve your knowledge about how we are working in that line, I think work package 10 nowadays working with the stigma and awareness plan in the society is really interesting. And as I said, if you could access to the project online, you will read we are highlighting mainly vulnerabilities and minorities, especially Ukraine immigrants and Romance groups. Yeah, both of them are the first line, and secondly, we have other vulnerabilities taken into account depending of the work package. But it's really important and was in line with the EU actions that we are integrated. Yeah.
Thank you very much.
Thank you so much. We only have a few minutes left, so I just thought I would take the time to start closing the conversation. It's been really great learning from you, Bernardino, and your team about the work, and we look forward to continuing learning, because I think this type of implementation work is really needed, and I think there's going to be a lot of lessons that will come out of this joint action across Europe. So definitely we're going to keep those channels open, and we look forward to sharing with the rest of the community as well as your work evolves. I do want to highlight that as part of this Dementia Research Dialogues, we also have right now 3 working groups that are working on specific research themes highlighted in the blueprint. So we have one on dementia diagnosis, one on risk reduction, and one on models of support and care. And that's, again, trying to implement the blueprint. So we are working on some work related to implementation, but it's primarily researchers, but it's always good to bring also other entities in that conversation. So I know some of your team members have already joined us, and we look forward to having you in those groups. But if anyone in the call right now is also interested in joining one of those 3 subgroups, you all have my email. So just get in touch with me and we can have further conversations on how to do that. And we're hoping in the future to have more subgroups, but for now, we're just starting with those 3 research themes. And with that, I wish you all a happy rest of your day. And if there's any final thoughts that you want to share, otherwise, it's been so great having you here and learning about this work. Thank you so much for joining, everyone. I will share the recording and any additional links as well in some further communication, so you'll have that in your inbox as well.
Thank you, Laura and Catherine. Thank you very much for your help.
Yeah, thanks.